Okay, we're back and we're going to talk about coding diseases of the musculoskeletal system. Here are some key points about this chapter. These codes include not only the location, but the anatomic specificity. In other words, what part of the bone or the joint is affected. They also deal with laterality, which is a total change from ICD-9. There are a lot of instructional notes in the tabular that indicate that additional codes are assigned for any associated conditions and also indicate which underlying conditions are coded first. There are different codes for the different types of osteoporosis that include the site of the pathological fracture in one code with the episode of care as well. You'll see, as noted, a bunch of notes to use an external cause code following the code for the musculoskeletal condition to identify the cause. So in other words, if somebody sustains a femur fracture from a fall, then you're going to use an external cause code to code that. There are some specific arthropathies that have two different types of etiological relationships. In other words, we could have a direct infection of a joint or an indirect infection of the joint. So let's take a look at some of these. We have M21.7, the site should correspond to the shorter limb. M50 point, code to the most superior level of disorder. The M66, the spontaneous rupture, and so on. So very important to look at some of these. Let's take a quick look at some of them in the tabular. And again, this is another chapter where you want to read the tabular very carefully, along with the boxes that are shaded in the tabular. You can see some examples of them here with M80. M80 is a good one because it has the appropriate seventh character to be added to each code from category M80. What this is saying is, in other words, if it's a code that starts with M80, you're going to need one of these characters. You'll also need them in the seventh position. So if you don't have enough characters, this is where the X placeholder will come in. And again, there are different guidelines that you'll see in this chapter. They're in the beginning of the chapter. They're also summarized very nicely in the text. Be clear on the difference between the bone versus the joint, the site, the laterality, whether something's acute, traumatic versus chronic versus recurrent, and make sure to check the tabular. And if it needs a seventh character, it needs to indeed go in the seventh position. That means that you may need one or two X's to use as placeholders. There are different guidelines for osteoporosis. We can have osteoporosis with or without a pathological fracture, with or without a current pathologic fracture. And these are summarized in this guideline 1.C.1.8.1.1. And again, a good chapter to keep in mind is one that's in your book, and there's similar ones in all the coding books as well. And this is something that talks about the bones in the body in figure 16.1. And here is something that is confusing for a lot of people that are new to coding, so I want to spend some time on this. We have a seventh character, seventh meaning it must go in the seventh position. If you don't have 6 characters, you will need to use a placeholder X to complete the 6, and then one of these will go in the 7th position. This includes A for initial encounter for a fracture, D, for a subsequent encounter for a fracture with routine healing. G, subsequent encounter for a fracture with delayed healing. K, for subsequent encounter for a fracture with non-union. P, subsequent encounter for a fracture with malunion. And S, for sequela. Let's take a look at what A means. A is used when the patient is receiving active treatment for the fracture. So if somebody has a fracture, they're admitted through the emergency room, they have surgery, they have a procedure, that's when A is used. D is used when the patient is being seen for subsequent encounter after the patient's completed active treatment and they're receiving routine care during the healing process. So going back to our earlier example, this means that the patient was admitted through the emergency room, was hospitalized, had a procedure, was discharged, and this is a follow-up visit. This is where you get D. G is used when the patient is seen during a subsequent visit and is determined to have delayed healing for the fracture or continued management of delayed healing of the fracture. K is used to describe a subsequent visit by the patient when it's determined there is a failure of normal healing, or in other words, there is non-union. The two ends of the bone are not fusing. And then P is the last seventh character that we'll talk about on the slide, and it's used to describe a subsequent visit, but there's a malunion. In other words, the two ends are fusing, but they're not fusing correctly. So in addition to A, D, and S, we have G for delayed healing. We have K for failure of normal healing or non-union, if you will. And then we have P for malunion. We talk about S, we're talking about a sequela. In other words, these are conditions that arise, right? Scars, different things like that. Right, and the sequela condition is coded as well as long as the original injury code. The S is added to the injury code, only to the injury code, not to the sequela code, if you will. Rheumatoid arthritis is M05 through M06, and this is a systematic disease that affects the connective tissue in the body. You can see figures 16.2, 0.3, 0.4, 0.5, 0.6, 0.7 about normal joints anatomy. Osteoarthritis is different. This is the most common form of arthritis. Rheumatoid has to specifically be called out as rheumatoid, and they do specific tests for this, as noted. Polyosteoarthritis classifies arthritis as multiple sites, and these are in the category M15. Primary osteoarthritis is not caused by another disease. This is basically wear and tear on the joints, right? Secondary osteoarthritis is something that caused from a predisposing factor, usually some sort of injury, some sort of trauma, if you will, that damages either the cartilage or the bone itself. There are other systematic connective tissue disorders that you can see here in code categories M30 through M36. These are usually documented fairly well, and you should be able to pick out the codes from these very simply. Lupus is a systematic chronic multi-system disorder. One of the manifestations is the joints itself. This is believed to be some sort of autoimmune disorder. And we can have arthritis in addition to nephritis, pleurisy, pericarditis, and many other things related to lupus. discoid lupus erythematosus is strictly lupus that affects the skin and subcutaneous tissue. So therefore, it's coded to the skin chapter beginning with the letter L. And that's all I have for you. Come back and we'll talk more about coding diseases of the musculoskeletal system.